So why is SIBO so difficult to treat for so many doctors? SIBO, small intestinal bacterial overgrowth, symptoms: bloating, burping, gas, stomach distension, stomach pain, constipation, loose stool. But why is it so challenging? Conventional medicine treats SIBO, overgrowth of bacteria in your small intestine, with antibiotics, Xifaxan. Integrative doctors use that antibiotic also, but the problem is that almost all the time you have it again. So your symptoms may improve for some time, but then they return, and it's very challenging to treat. Well, the reason for this is because the root cause isn't addressed. It's important to address why the individual developed SIBO in the first place. Why did you get it and someone else did not get it? If we only go after getting rid of the bacteria, maybe the symptoms will get better for a little while, but of course it will return because we never address the root cause. So it's very important to address the root cause. Some of the root causes of SIBO are, for example, low thyroid function. And if you have low thyroid function, we want to know why you have low thyroid function. It could be low digestion, low stomach acid. It could be taking antibiotics in the past, and the health of the whole gut is off track. When the health of the whole gut goes off track, you can also develop SIBO. That's why looking at the big picture, stepping back and saying, how did I develop this? Why am I here? Versus, just addressing the symptoms. And some of the root causes of SIBO can be some serious conditions such as type 1 diabetes, but those are more rare. SIBO is actually much more common, so it's underdiagnosed and undertreated. It's also important for physicians to have a high index of suspicion, and yourself as you're learning this. If my stomach is bloated, it's very likely, or it could be, that I have bacterial overgrowth of the small intestine, because traditionally this isn't really put high on the radar. If you complain of stomach pain, you're a young person, to your doctor, it's likely you're gonna get yourself a colonoscopy, but it's much more unlikely that you have colon cancer than that you have something like SIBO, which they don't really look for. You have to, basically go to some of the more advanced centers to get tested for SIBO. But once it's tested, remember, antibiotics alone, like Xifaxan, aren't going to do the job for you in the long run. In the long run, you have to assess your entire health, your hormones, your thyroid, your toxins, your microbiome, your nutrients, to really get the gut back on track. Digestion, all of that has to be addressed at the same time, and then we can do some targeted treatments, of course, for SIBO, with targeted antimicrobials, healing nutrients for the stomach mucosa and things like that. But without addressing the whole picture, we're not going to be successful.